Sometimes the throat is irritating if the kid is more than 1 year old. Sometimes a teaspoon of honey once or twice a day will help to soothe the throat. Cold, mist air sometimes helps. Medical management is usually required for very small kids, particularly for less than 4-month-old. Particularly if you have severe symptoms, we need to hospitalize also. Hello everyone, I am Dr. Gopal Agrawal, consultant pediatrician at Cloudnine Hospital, Sector 47 and Sector 14, Gurgaon. Today we'll discuss about a common disease in children and smaller infants, that is whooping cough, and we'll discuss how we'll differentiate this from other common causes of cough. In addition to this, we'll discuss about the common symptoms, how to diagnose and how to treat this disease. Let's start by understanding what is whooping cough, also known as 100-day cough. It is also known as pertussis. It is a very severe disease which presents with severe and persistent cough, and it is called whooping cough because it is associated with a typical whoop which happens during inhalation during the bouts of cough. Primarily it spreads through respiratory secretions or aerosols, and we as adults are actually the reservoirs of infection. It normally affects smaller children, particularly infants. It is caused by a deadly, very highly infectious bacteria known as Bordetella pertussis. Symptoms are usually divided in 3 phases. First phase is usually lasting for 1 to 2 weeks when kids have cough and nasal congestion, which is common across all infections. Second phase usually lasts slightly longer, nearly 30 to 40 days, where they have persistent cough which presents with bouts of cough followed by whoop, which is classical sign of whooping cough, and sometimes with post-pertussive vomiting. These are the 3 classical signs of whooping cough. Third phase is a recovery phase, when the cough actually comes down and the symptoms become milder, but usually the total phase lasts for around 60 to 70 days, nearly 100 days sometimes. So as you can see, the total duration is very long. That's why the other name of this disease is 100-day cough. Rarely this disease is associated with pneumonia, sometimes with some complications like air leaks. Rarely it causes seizures or fits, and in infants it might cause breath holding spells also. If you talk of other common causes of cough in this period, these are common cold, upper respiratory tract infections such as pharyngitis, bronchial infections, sometimes allergic cough, and rarely we see reflux GERD which presents with similar type of cough. If we talk of specific pointers, allergic cough predominantly presents with dry cough, and it has intermittent wheezing which may be triggered by exercise, cold air, allergens in the atmosphere, pollution or dust. Upper respiratory infections usually has wet cough and associated with usual infections, and baby has other symptoms along with cough like fever, rhinorrhea or nasal congestion. GERD, which we talk of, reflux, usually associated with meals, and babies have vomiting episodes or triggered by heavy meals. In our developing countries, one of the common causes of chronic cough similar to whooping cough is tuberculosis, but in tuberculosis you need a contact with TB. There usually is persistent fever which lasts more than 2 weeks. There is associated weight loss, and usually baby or kid looks sicker than in whooping cough. So summing up, with one of the common features of more than 2 weeks cough, you suspect whooping cough or pertussis, but it should be associated with one of the following. The cough should be paroxysmal, or it should come in bouts. It should be associated with whoop, which is the signal for diagnosing whooping cough. It is followed by post-pertussive vomiting, which means cough is usually followed by vomiting, and in small infants it might present with breath holding spells or blueness of the body. To confirm the diagnosis, you need to take a swab from the nose and the posterior pharynx, but growing this organism in a culture medium is very difficult. Sometimes PCR assays helps in diagnosing this. Usually it's diagnosed clinically, and treatment can be also initiated. So how do we treat this? Once we diagnose and confirm that this is whooping cough, we need to see when we need to treat it. So basic treatment and management of all viral infections applies to this whooping cough also. So plenty of rest, plenty of fluids to help the baby or child to recover, and sometimes the throat is irritating if the kid is more than 1 year old. Sometimes a teaspoon of honey once or twice a day will help to soothe the throat. Cold mist air sometimes helps. Medical management is usually required for very small kids, particularly for less than 4-month-old. Particularly if you have severe symptoms, we need to hospitalize also. If the cough is very severe to trouble the daily course, definitely we need to treat it. Antibiotics is not given routinely, but definitely if given, it reduces transmission of infection to others. It might reduce symptoms, but it predominantly helps spreading of infections. Special caution groups are pregnant women, kids less than 6-month-old, and any kid with immunodeficiency. Danger signs are if any kid has episodes of holding breaths or if the baby turns blue. That is one of the difficult and dangerous signs to manage. Any kid has chest pain during coughing, probably that points towards pneumonia. Any baby having fits or seizures, probably that has systemic manifestations. These are the 3 signs which kids should be hospitalized and a pediatrician should be consulted. If you talk of prevention, vaccines are available for pertussis, and most of the routine vaccinations which you give to kids at 6 weeks, 10 weeks and 14 weeks has a combination of DPT, where the P stands for pertussis, the other D is for diphtheria and T for tetanus. So this combination vaccines actually protects us from pertussis vaccine. Along with there are multiple booster shots at 1.5 years, 5 years and 10 years. So there are lots of vaccines which helps in prevention of pertussis. Pregnant women should get at least 1 dose of vaccine against pertussis during pregnancy. Any newborn should be protected with pertussis by giving adults and other children around the newborn, they should be vaccinated. So summing up, pertussis or whooping cough is very difficult to diagnose, but if you know the common symptoms and any baby presenting with chronic cough more than 2 weeks old, we should suspect whooping cough, because it's diagnosing and treating early might prevent spread of infection. So it needs early diagnosis and proper management. So once you diagnose it properly, it can be managed. If you have any concerns regarding whooping cough for your kid, please speak to your pediatrician, or else you can put your comment and queries in the comment section. We'll try to answer that. Hope you like this video and learned something about the highly infectious disease. Thank you for watching. Bye.